tell us more of those good things in Health Committee. One more question. I realize we're in a hurry, but what is the plan or incentive to attract top-notch doctors, nurses to rural Oklahoma? I asked Melanie last night, will we be more or less a general hospital? Will we be focused on being a specialty hospital? If so, how do we attract these top professionals to top Oklahoma?
Well, I'm going to address it even broader than Tahlequah, Oklahoma, because I'm responsible for the whole 14-county area of Cherokee Nation.
Well, rural Oklahoma.
And so, I mean, first of all, let me say that all of our providers are top-notch, the ones we currently have. We have a very rigorous credentialing system that we credential all of our providers by, and yes, we have some providers that don't make it through and we don't hire them.
Mm-hmm.
So I think our credentialing system is even more rigorous than Indian Health Service. If there's anything that's more rigorous than Indian Health Service, it's our credentialing privileging system. So we have that currently in place. So all of our physicians are either board certified. We have a few that are board eligible that are taking their boards, but most of them are board certified, and I think the same is true at Hastings Hospital. All of their providers are very top notch. So we have a full-time, actually she's part-time right now. I think I've said this before, October 1st she'll go full-time. That's going to be a health professional recruiter full-time. We have a recruitment plan that we've already started implementing. We've been implementing it for about a year, and so we're going to be producing vacancy percentages, retention percentages. I mean, that's going to be part of her job, is filling those. We've connected with directed studies in education. We have a whole health track there that we're working to get people in that track to help them, get their education paid for. She has learned and figured out the whole Indian Health Service loan repayment and scholarship program. So we actually help people fill out their paperwork and get that in so they can be eligible for those. We've been very successful in getting people approved for loan repayment, probably one of the most successful organizations, and actually the number of people we've gotten on loan repayment. So all those things are recruitment tools for us to get people to rural Oklahoma. And then a big recruitment is that once you have that base, we have 70-something providers, and I think Hastings has about 60 or 70 providers. All of a sudden you've got 140 providers, and who knows other providers but them providers. So they start working in a system that is good and allowing them to practice and do the things that they need to do to care for a population, and they're one of our biggest assets in recruitment. So I can go on and on, but you get the picture.
Oh, you're doing good. It's one thing to provide comprehensive health care, which is your goal. To me, it's just important is how do we enhance the quality of health care, but I think maybe you answered that. We have published standards and guidelines.
Absolutely. And I can tell you just another brief example, not to get me started on our healthcare system, but another brief example is, we were one of the 14 pilot sites in the nation that got accepted as a pilot site in the Planned Care Initiative, which is a partnership with Indian Health Service and the Institute for Healthcare Improvement, which the Institute for Healthcare Improvement is a worldwide quality health organization. And so we're one of the 14 pilot sites in there, and we've done better than any of the other pilot sites. They've all done fairly well, but we've done the best. And Dr. Cobb actually went with us to their World Conference in December, and we were highlighted at the conference, with 5,000 people there, and so we have the Indian Health Service or the federal government passed the Governmental Performance Results Act, which is GPRA, and those are all quality outcome measures. We participate in that program. We do very well in that program.
Okay, that was my next question. We do have measurable outcome
Gloria's going there.
And we have lots of measurable outcomes, and part of that's dictated not only by the government through GIFR, because we get federal funding, but also because we're accredited through AAAHC or through JACO or through CAS or CARF, depending on which part of our healthcare system you're dealing with. So they have very strict guidelines on showing outcome measurements. So we have outcome measurements for lots of disease processes as well as non-medical processes, because we want to show improvement in all of our, whether it's a billing process or a healthcare delivery process. So we have outcome measures for all of those kinds of things, and then we judge them against the national standards. We have a benchmark to see if we're above or below.
Oh, great. I have more, but I think they can be asked more privately, so.
And anytime you're welcome
Well,
to
we're
come
gonna
over
get the
and
deal
make an
quick.
appointment and
Next
we'll...
question.
Now wait, I want to talk about it. And come over and we'll be glad to show you our reports, anything you want to see. I mean, we have bukus of quality issues that we work on all the time.
Thanks for your time and all the work you put into this. And I saw Melanie once, and you looked really, really tired.
I hope I look better.
Appreciate all the effort.
Allow for a couple more. Go ahead. I'm sorry, Councilor Callen Watts, you had a...
No, you already allowed for it. I was going to cautiously ask to call the question.
Councilor Hoskin, you have the floor if you could.
Yeah, withdraw.
And last question, Councilor Fishing-Hawk, you have a question for me?
I was just going to tell you, thank you for suspending the rules for a minute for common courtesy.
You are welcome.
Okay.
Are there any more questions? I believe we have a motion on the floor and a second. All those, and I believe we do have an amendment that's been accepted to that. All those in favor of passing item 2 as amended, state so by saying aye.
Aye.
Are there any opposed?
Aye. Roll call.
Roll call, please.
Don Garvin,
Yes.
Chuck Hoskin Jr.,
Yes.
Tina Gloria Jordan,
No.
Curtis Snell,
Yes.
Chris Soap,
Yes.
David Thornton,
Yes.
Kara Callan Watts,
Yes.
Yul Anglin,
Yes.
Jack Baker,
Yes.
Harley Buzzard,
Yes.
Julia Coates,
Yes.
Bradley Cobb,
Yes.
Joe Crittenden,
No.
Jody Fishinghawk,
No.
Meredith Fraley,
Yes.
Janelle Fulbright.
Yes.
We have 13 yes and 3 no.
Resolution passes. We're down to item 3. And I believe we have a new... Councilor Jordan, this is your... And did everyone get a copy of the new...
Everybody's got a copy of the new amount, of the new act. Can we get,
I've got her one. Here,
let's see, Dawn, did you get one?
Does everybody on this side have one?
I think wait, I'm sorry. Did you see that online? Todd, I think you probably need a copy of that.
I do need a copy of what. The other one.
she gets finished passing now. Go ahead. I want to make sure everybody's got one in their hand first. Go ahead.
This is an act that I would like to sponsor before this honorable body. It has nothing to do with the assumption
of the Hastings Hospital area. What it has to do with is a plan for the future, a future direction of the health area within Cherokee Nation. It has basically taken the clinics that we have talked about off and on for the last 10 months and put it into one act with a plan for resolving at some point within this act at 6 months to establish some sort of appropriate funding level for those clinics, and then through a master capital improvement plan that would be adopted by us to construct those clinics. It also includes a paragraph that covers the IPA agreements there at Hastings that Cherokee Nation agrees, and I think this morning, I think they even made the comment, I believe Melissa did, that you all have never objected to the continuation of an IPA agreement. And this just gives assurances to the 400 classified IPA folks up at Hastings Hospital that we will not object to their continuation as long as their evaluations are good and there's not a work performance reason for objecting. The clinics would include a new medical clinic located at Tahlequah, Oklahoma, adjacent to W.W. Hastings Hospital. It would include the new medical clinic at Jay, Oklahoma. As I understand now, that clinic has quite an involvement with mold, and so we opted for a new medical clinic to go into our long-range plans. It also would include a long-overdue dental clinic at Salina. And it would include the new medical clinic, which is already on the drawing board, at Veneta. We went through a lot of reconstruction of this particular act. We got the input of Chief Smith, and I think he's probably already had to leave today. That's why I asked him earlier to establish his position on this act. I believe this act shows not only what we want to do, but it gives guidance to our vision for the future. If you all remember, about 3 weeks ago or 2 weeks ago, the chief gave us kind of an outline of what he would like to do up at Hastings Hospital. And I think if there's any concern about Hastings Hospital operation, I think it comes from the lack of space, which was one of the things that we talked about this morning, and that a separation of the clinic from the hospital might solve a whole lot of problems that they're encountering because of that lack of space. I would ask and encourage each and every one of you all to find it in your heart to put this vision in writing. And for that reason, I'm submitting this in the form of a motion. But before I do the motion, I would ask, is there anyone else that would like to sponsor this act?
Mr. Chairman, I'd sign on as a co-sponsor.
Councilor Hoskin and Councilor Fishing Hawk.
I'll
And
sign
Councilor
on.
Fraley.
I just want to talk when the second.
I gotta get them.
Let's see. Fish and Hawk. Okay.
Councilor
Joe,
Cook.
Crittenden. Would there be anyone else that would like to be a sponsor? I think this shows our vision of what we want to do in the future. Of course, this can be added to periodically. It doesn't have a timeline in it, and that's one thing that we've had a great number of discussions about. That timeline will come in the form of that comprehensive plan that will come back to you at a later date. I would put that in the form of a motion at this time.
Second.
We have a motion, we have a first and second. Councilor Callan Watts, we're in discussion, you have the floor.
Thank you. I'm greatly encouraged that we're looking at additional healthcare facilities because I don't think we've met our 30-mile radius minimum across the 14 counties. I know my community suffers a lot, and I noticed it's not listed on here. And so the thing about it is, this was sprung on us today, which is contrary to, I know we've been trying to change that about doing last-minute stuff, and especially something that would include so much money and it's not comprehensive for the whole 14 counties. So it's not that I don't support these facilities or the idea that we need a comprehensive plan, but I understood that the administration was bringing forward a comprehensive plan that would include some kind of time frames and also budget numbers at our budget hearings that are coming up pretty soon. So I just can't support this legislation today. I think this is something that needs to come from a more comprehensive place. Thank you, Mr. Chair.
Councilor Baker, you have...
Yes. One concern is for item A, item 1, new medical clinics located in Telequa, Oklahoma, adjacent to W.W. Hastings Hospital. Suppose we find that an ideal site would not be adjacent, but somewhere else in town.
Well, it's certainly open to amending. Are you wanting to?
I would say just new medical clinic located in Telequa, Oklahoma.
Are you offering that as a friendly
Yes.
amendment? I would-
Before you do that, I think, Melissa Guyer, did you have a statement on that?
Yeah, if I could just make a few statements.
Could you do me a favor? Could you direct it to that part of subsection A first about the
I can.
clinic, and then we'll...
I can.
Because I want to, they've got a...
Well, my concern is this. One is that we have a capital improvement plan, the tribe does. We have a long-range health plan and a health facility master plan that I've provided to y'all previously. My concern is that if we're pulling some of those functions out and putting them in an act, then what does that do to the whole plan? Okay? For example, there is a Jack Brown Center that we need desperately. I mean, it is just a desperate facility that we've got to do. That's not on here. Does that mean that we can't do Jack Brown Center anymore? I mean, I can go on, okay? And then my next question is, or concern, is if we say on number 1, new medical clinic, well, you know, I think I explained that our whole purpose was to separate the inpatient from the outpatient. So if we do a study and we determine that the best use would be to actually build a new inpatient facility and leave the current hospital as the outpatient, does this prohibit me from doing that? Next is J. Let's talk about J for a minute. I mean, we're going to build a new facility at J. It's in the plan. The problem with putting J in here, I see, is this says new medical clinic at J, and then it has some, you know, general time frames in it. We want to apply for a joint venture for J. We're going to do that. If I do that, I'm not going to have the financing plan in 6 months. Is that going to prohibit us? Is that going to make me just build a replacement facility for J and forego having new services to offer to the Cherokee people in J? I mean, you get my concern is I'm concerned about pulling out pieces and putting them in an act when we've got the overall plan. Now, if you want, you know, and I think we've talked about this and talked about it, and, you know, I've recommended that we bring the plan over and you look at the whole plan. Budget time is a great time to do that. And if you officially adopt that plan, you know, I think that's good and fine. I just have real reservations about pulling pieces out and limiting our ability in healthcare facilities. Thank you.
Councilor Baker, you still have the floor, and I believe there's a discussion about
Friendly
it.
amendment?
Yes, I'll just put an amendment to strike adjacent to W.W. Hastings Hospital.
And I would agree to that.
I agree.
And did you have anything else?
No.
Councilor Hoskin.
Thank you, Mr. Chairman. I don't read anything in this act that is of a limiting nature. In other words, the list doesn't mean that other plans that the administration has are suddenly you know, prohibited, because certainly if the council intended to prohibit certain clinics, we could, and we're not. I think this strikes a good balance between allowing the administration a great deal of flexibility to determine appropriate timeframes for construction, and our need to embrace that healthcare facility master plan, and our need to ensure that within a reasonable time period, we're at least identifying funding sources. Ms. Gower mentioned that the prospect of a joint venture grant with IHS as it related to the J facility. Subsection C of Section 5 talks about 6 months from the effective date. The Cherokee Nation shall identify the source of the appropriate funding level for the construction. It's not clear to me that the administration that the administration would find it impossible to comply with that subsection. All it's saying is that they'll identify the appropriate funding level. It I think, is a way for the council to embrace the overall master plan, and in that regard, there's nothing to say that we can't amend this from time to time to further embrace the other clinics that the administration have identified. So again, to me, I don't see this as having any kind of a limiting effect on the administration. I'm not persuaded that it's going to wreck the administration's master plan. I think, in fact, it enhances it, so I would encourage my colleagues to join me in supporting it. Thank you, Mr. Chairman.
Councilor Fishing-Hahn.
Yeah, this is a question maybe I need to ask you. Was it my understanding on the chief a while ago, I was in the middle of coughing, that he said this, did he not describe this as more or less as a reaffirmation of whatever we've already got said?
Can you go back into the notes and find that? No.
Okay, another question is, and if Melissa can't answer these with a short, simple answer, don't bother, okay? Here's my question. The new medical clinic located in Tahlequah, Oklahoma, the thing that we have listened to the chief ask us 2 or 3 times to say that we're going to do something with the clinic, and I know Bill John and Time is frothing at the bit over one, as well as all their constituents. What is the time frame you actually think that it will be done in? I don't want one saying 10 years, I don't want one saying 3 years, and oh, it went over. I want to know, honest to goodness, when you think a clinic will be done in Tahlequah. Can you tell me 1, 2? You do not know?
Absolutely, I do not know.
Okay, medical clinic in J. Can you give Harley and Curtis a timeline?
I can tell you what's on the capital improvement plan.
Give me that
which
year.
is that we start beginning design in '09.
09 design. And roughly how long
And
does it
that
take
means
to
that
do?
we will apply for a joint, she said if I couldn't answer it in 1 or 2 words,
Come
don't
on,
answer
come on,
it.
speaker, just for a second. Just answer into the mic, so, because we got people watching.
Even though you can hear me from
I
the
can
barn.
Hard guys trying to find
You
it
know,
on the screen.
for J Clinic, if we apply for a joint venture, which is going to bring additional services to Delaware County, okay? If we do that, that application will go in I think it's January, February when those go in. We will know in probably, was it Chuck, like April, I think, whether that's approved or not. If that's approved in April of '09, then we begin our planning process for that. Can I tell you when the clinic is going to be finished in J if we get accepted to joint venture? Absolutely not. Because I don't...
10 years down the road.
Well, no, it won't be 10 years, but I don't have all the information to tell you that.
Okay, could you even say anything about the dental clinic in Salina?
I can tell you the status and update on the dental clinic. The dental clinic at Salina, we just need the money to build the facility, okay? We're carving out the operational dollars out of Muskogee to fund the operational piece of that. We got shorted $7 million for Muskogee this year. We're supposed to get $3 million of that for fiscal year 10, which would be starting in October of next year. So we will have operational dollars at least by the time it's built, if not before.
But you're not going to give me a date on the dental clinic?
I can't give you a date when it's going to be finished because lots of things could happen. I mean, we've got to outline a construction schedule. I got to know how we're going to pay for it. We got to identify the sources to be used to build that facility. I can't give you a date when it's going to be finished.
Councilman.
I would be erroneous to do that.
I think she's answered probably to the best of her ability. Do you have another question?
Yeah, I have one more. No, the same picture. Have we ever identified funds, the for a dental clinic at Salina?
Several years ago, part of an expansion effort that was funded in Salina was for, part of the occupancy of that south end of that clinic was for dental. That was part of the discussion. How many years ago? Several years ago. When the south end of that building was added on, that financing was justified with a dental lab in it.
Could you look up them
I'll be happy to look
minutes,
up.
because I'd like to see what's in. Okay, thank you. That's it, thank you, sir.
Councilor Hoskin.
Just along the lines of the joint venture, could you kind of use, Melissa, could you kind of use the experience with Veneta and kind of draw some parallels with what you anticipate might happen in J? In Veneta, you were successful with the joint venture grant and things have progressed along.
I think, and again, it's hard to pull these dates and times off the top of my head, but I think we applied in January. We got word in April, if I'm not mistaken, that we were approved for Veneta. Okay? Then we have until September 30th to get the land. I mean, you have to buy land, you have to have an environmental clearance on the land, which we're in the process of completing right now for Veneta. That needs to be done by September 30th. Once that's done, then you start a program of requirements and program justification document with Indian Health Service, which designs the space and the staffing and formula-based, all that, and that takes, I don't know, Muskogee, it took us about 18 months. So it's a planning process that you do all of that. That has to go all the way up to the Director of Indian Health Service for approval. In the meantime, you have to, start trying to figure out how you're going to finance the construction. Once that's done, then you start on the preliminary conceptual design for the facility so that you can start pricing it out and getting, bids on the A&E and on the construction piece of it, and then it's actually construction time.
And I'm not needing to hold you to any dates, but a similar process might unfold with...
Yeah, I mean, it's, once you're approved, just a best guess would be, somewhere around 3 years.
And I have a follow-up from Mr. Hembry. Thank you, Melissa. Mr. Hembry, I said a while ago that I didn't see anything in the legislation that had any kind of a limiting effect on the administration. They obviously already have a master plan, and nothing in this legislation calls for them to scrap anything. I mean, for example, in subsection B of section 5, maybe it doesn't list every item that's in their master plan, but that doesn't mean that the council is ordering the administration not to pursue those other items.
No, the only thing a legislative act is, as you know, the law of the land, and the difference between, it's not, no, it doesn't prevent you from going after building other clinics, doing anything else. It just requires you that you must do this because it is an act.
And this, as I read subsection C of section 5, we're just asking, the law is just going to require that they identify sources of funding, not that we fund it in 6 months, not that we turn dirt in 6 months, that we identify sources of funding. Am I reading that correctly?
That is correct.
Thank you, Mr. Chairman.
Councilor Jordan.
I guess this is more a comment than a question, but from what I'm hearing Melissa say, we have identified that we're going to build these 4 clinics. And from listening to what she just said, she can answer already the source of funding for 3 of those clinics, which is what Part B is. She tells us that we have a master capital improvement plan, which has been adopted by Cherokee Nation government, so she's met C. The only thing that we haven't addressed is the IPA agreements and not opposing those. And I would ask Melissa or Melanie, whoever would want to answer this, do you all have any opposition to the wording of D, which talks about IPA agreements between the current employees, that you all would not oppose their continuation as long as you reserve the right not to renew if there's a disciplinary or work performance reason. I think you've pretty well answered A, B, C, and D already in Section 5.
I believe you already answered that on our last item too.
I think the only thing we would need to address is
I'll be glad to answer.
the IPA.
On E,
It's actually D.
okay, well, the only thing that's wrong in that is it's intergovernmental agreement, not intra.
Yeah, this one.
Okay, enter,
I mean, that's technical, but-
INT.
INTER, inter.
Okay, I would ask
Okay,
that
and-
my motion be
and the-
amended to that.
And on B, or whatever, A, my concern is still actually putting medical clinic in there. Because what if we do the plan and it's better to build an inpatient facility? The purpose is to separate
I would
those.
assume, though, if you build a new hospital, you're going to create the clinic at the old hospital through a construction process. It'll have to be redone. Is that right, Melissa?
Well, I'm sure there would have to be some renovation.
And would that not be a new medical clinic?
Well, I wouldn't consider it new if it's in an existing facility, but...
Well, it's a new standalone clinic, right? I think we're all saying the same thing. It appears to me from the comments you've made that you covered A, B, C, and D. It appears you have covered A, B, C, and D. So again, we're not limiting what our future health plan will be. We're just basically reiterating what we've already talked about and putting it in written form. I just do not see how anyone can oppose that we establish in writing that we're going to do these 4 clinics. We've got to be forward-thinking here, that there's a future in health and we need to be a part of establishing the plan. And that's all this is to establish the direction we're going to go in the future. It's not to limit new items that might be added at a later date or that might already exist on the drawing board. It's just to make sure that these 4 clinics are going to be done. It's to make sure that what we've told those employees verbally is what we're agreeing to put in some sort of written fashion. I'm kind of at a loss to see what anyone's opposition would be to a new dental clinic at Salina, a new medical clinic at Bonita, a new medical clinic at Jay, and a new medical clinic here, because these are things that we have publicly stated. Not only have we stated this, but admin has stated this. And that's all.
Counselor Sugg.
Again, I would like to correct that number D to be inter, I-N-T-E-R. And Chuck, I think you did the second.
Yeah, I'll accept that.
Counselor Sugg, you have the floor.
Yeah, I just have a question about, as far as our capital planning goes, there obviously was a plan, there's a sequence that one would think that we would initiate the plan. And so, Melissa, how do these specific locations, Tahlequah, J, and Bonita for medical clinics, fit into the sequence of that plan? I would not be opposed to supporting legislation that says that we would initiate the construction of 3 clinics or the establishment of 3 health care facilities within the Cherokee Nation, but just as far as the specific locations, I feel like that limits us a little bit as far as maybe providing for the best location in regards to funding or partnerships with other people. So can you comment on that real quick?
I can, and Councilor Sloat, first, the capital improvement plan that I've seen, okay, And that's done by Management Resources, and they're the ones that's over facilities, and so they develop that with with everybody at the tribe's input into it. So it's really long. I think the whole plan is like $61 million long or something. So the health pieces that are in there, and I'm doing this off the top of my head, which is not good at this point. But, include, and this was part of our long-range plan for health, include J Clinic, okay, Salina Dental. It also included Muskogee, Nowata, and Redbird Smith, and those we finished. It includes Bonita, and we need something at Bartlesville because we're in a rented facility there, and that process. So it includes that. It includes, if we assume Hastings Hospital, it would include the development of the 45 acres or the Burchett property, what we call, that's adjacent to Hastings, which has numerous things on it. The whole plan for the 45 acres has a retail building for doctor space, it has a daycare center, it has a Jack Brown Center, it has a medical storage facility, it has a health programs and services building, it has a health facility, a health services facility, whether that's outpatient or inpatient, we haven't determined that yet, but I think there's altogether 8 or 9 buildings on that actual site. So, that's all long-term, and it's spread out in the plan over a 5-year period. Okay, so there are numerous of those that start in 09, fiscal year 10, 11, 12, and 13. Now, it's one thing to have a plan, it's another thing to have that plan developed and financing developed for all that on how you're going to implement it. The financing piece of it, we don't have done. How we built the other 3 facilities was through issuing healthcare construction public bonds. Well, my debt service for those is through third party. Our third party is pretty much plateaued, so it's not going to increase a lot for me to debt service those out under third-party billing. So I'm probably not going to be able to do that in health. So we got to think about, can the tribe do a big third-party, a big debt issuance on behalf of all the tribe for that whole plan? I guess you see what I'm saying. I'm just going on, I know, but
the thing that I'm interested in for sure is the site selection. Is that are there any issues with being very specific about site selection at this point? It appears to me that it is in agreement with the existing capital plan, that we're just restating what is already in some plan, but I just wanted to be sure that there wasn't other potential site selections that would be eliminated by preemptively being so specific in our act that we state it's going to be in Tahlequah, it's going to be in Bonita, or it's going to be in J, whenever there may have been room for flexibility in your capital improvement plan that you would expect to have some type of flexibility.
Well, I can tell you, I can tell you, and I'll be short, I can tell you for Bonita, it's going to be in Bonita because that's what we were approved for. Okay? For J, we haven't bought land yet. We have land that we would like to acquire for it to be in J. I don't know, I'm not opposed to it being somewhere besides J as long as it serves that population there. Once we apply for joint venture, then we've set the site location, but we have not actually done that. For the facility in Tahlequah, we already own 45 acres there, and our site plan for that 45 acres does include all of those health facilities. And I have no intentions of, looking elsewhere because we own 45 acres there. Salina Dental, of course, would need to be onto the current clinic, so I think that site is set.
Okay, one more follow-up, Mr. Chair. is that in Section C, I believe it still references Section B. Have we taken care of that, or?
It actually, I'm sorry, Chris,
Apparently we changed
Yeah.
the number, and then that needs to be,
would that be a friendly amendment that we just change that to A?
I mean, I'm just pointing it out, not really asking for an amendment.
I would agree that subsection B needs to be changed to subsection A.
I agree with that,
And
yeah.
then,
And that's also in the following section too.
okay, in B and C, we would change the subsection B to A in both of them. Is that right, Todd?
That's correct.
Okay.
Is that all, Councilman Sullivan?
Yes, thank you.
Councilor Fulbright?
Yes, I have several reservations and questions still lingering here in my mind. I've been on the council almost a year, and if I've ever seen a master improvement plan, I must have had an Alzheimer's moment, because I haven't ever seen it, and I would love to see it. And I think Councilor Soap is pointing out the point that we, as tribal councilors, don't feel like we have had any input at all into site selection. And I know plans do change, because we've been wanting a dialysis center at Salisaw for a long, long time, and Mr. Thornton told me that the land was purchased down there to do that, but then evidently the planning committee thought more people could be served by building the annex on down there. But I think we have to be very, very careful. I'm sure all these well-educated, important people who know a lot more about medicine than me thought all this out, but we have a huge multi-million-dollar clinic sitting over at Muskogee that is more or less a ghost town right at the moment. People aren't utilizing it. And that was in somebody's big master plan. And I'll be so happy when a lot of people start going over there and they maybe unclog Redbird and Hastings, and nobody more than me wants a new patient clinic over here at Muskogee. I mean, it's Telequa, excuse me. Because if you ever go over there and actually try to use it, it's a nightmare. Trying, so it couldn't be, us taking it over will be nothing but an improvement. But I really am not for this, because to me, it limits us. I'm not saying that it does limit us, but I want to see the master plan. And I wish that we all had a little bit of input into it, because it looks like if we ever do see it, it's going to be after the fact. As Melissa said, it was a $61 million plan, and it's all been decided already. And I would really like to see it in the budget hearings and examine all of it. I'm sure all these things are needed here, but as Councilor Soap has asked in previous meetings, like, who picked out this location? I'm sure there were studies done and all this. There were bound to be, just to spend that many $1 million to build the most fabulous medical clinic anywhere over at Muskogee. And you go over there and look at the parking lot and visit, and we're hoping all the bugs will get worked out of the system over there, and time will cure it, and people will start going there. But I'm not sure that the planners had the best judgment in mind, and I want to see the plan before I vote on anything. That's all I have to say.
Madam Speaker Fraley.
Follow up on Chris's statement. On Section 5A, those aren't listed in any order of priority, are they? I want to make sure this line was first. No, just kidding.
They are there.
No, they're not listed in any order of priority.
No.
Councilor Fishing Hawk.
Budget time, I think, Melissa said would be a great time to go over this, and I would love to be able to go over this if we're not rushed and if we have time, because it's very interesting to me, because it's healthcare. Not all of us choose to go on to college. Maybe we're not using the educational program all that much, but healthcare affects us, everybody at some level, and I would love to be able to take some time during budget hearings to go over some of this and not be rushed, without having people having appointments or calling for the question or saying you're taking too long. But then again, I'm
In that,
dedicated, this is my job that I'm dedicated.
if I may, Melissa, in that vein, you had mentioned at budget hearings that you may have a master plan outline.
I defer to Melanie, she's actually the one that made that comment.
I was just going to say that Callie is planning to bring forward what's planned in the capital improvement plan for discussion, along with the discussion of how to finance it perhaps, because that is the biggest discussion we're having internally, is we've got this wish list of needs, and how much are we willing to borrow, and how much are we willing, do we need to try to finance other ways?
You saw the floor.
Yeah, where does the council's wish list of needs go compared to you
Well,
all?
we have put the council's, for example, the council house is on that list.
Well, I
So
thought that-
there's various things that, we've got input from you about that are on that list as well. So obviously, budget time is the time to talk about that.
Present them to Doug? We'll present them to you.
Councilman Crittenden, and I'll
Thank you, Mr.
take
Chairman.
a couple more after that. We need to move on with discussion.
Just a reference to Mr. Soaps, Councilman Soaps' comments a while ago about the order of, or where these clinics were going to be as far as how they compared to the master plan, capital plan. Obviously, the sites were the same, and there's no order necessarily. I think, listening to what Melissa said about the master capital plan, I think she listed the clinic at J first in her comments, the Salina clinic second, and Bonita third, and then possibly Cherokee County or Tahlequah fourth. I don't know if that's the order or whatever in the plan. The other question I would have would be for Melissa, wherever she went, but the dialysis center down in Sequoia County, I'd like to kind of know where that sits on the master plan, or when that's scheduled or whatever, because as Mr. Thornton said, if the land was purchased way back there, obviously something's kind of happened there to slow it up, so I would be concerned about that.
I'll
So-
address that. Melissa took a phone call real quickly, but
All right.
we do try to get third parties to leverage as much of those kinds of facilities as possible. And what we've been trying to do is get a third party to site the dialysis center there and fund it, so that the nation doesn't have to. And I think Gloria can give a short briefing on what the status of that is.
Yeah, well, I'll have Rachel talk about it. She's been working with DaVita. Does everybody know Rachel? She does our
Hi, I'm Rachel
strategy and
McAvey.
development.
The update on dialysis is that we've had several companies come in and want to have an interest in it, but for their interest, they have to have a patient mix that weighs their financial gain. And so when it gets to that point, then that's where things get a little bit iffy for them. So everybody we've talked to has run into that. However, DaVita has expressed a great interest in it, and they're still working on their plan to propose a business plan for C&B to approve. So it's in the making. It's just taking some time to get those patient numbers, and I've been communicating with Janelle about that. She's been real helpful to help me get information that we need. And actually, I have a call with DaVita as soon as this meeting's over to discuss it.
Okay. Thank you, Mr. Chairman.
Councilor Thornton, we'll take one more question after that.
On the situation of the dialysis center and the annex that was added on, that annex in reality was first passed through this council, and it was piggy-tailed in on the budget of 2000. And it was piggy-tailed in there for the dialysis center and for the annex to be added on and put the dialysis center in the annex. Somehow, we ended up adding on the annex, and the people out of the Redbird Clinic moved over into it, and there wasn't any dialysis center put in there. But my question is the annex large enough to put a dialysis center in it at present time? Since we moved all these offices out of one building into another.
The problem is it's not set up for a dialysis center in the sense that it doesn't have the right plumbing, the right water source, doesn't have, and plus there's not enough space I mean, we're already outgrowing our existing space, but even aside from that, if you tried to make room, it's not constructed the way that we need to be
Is
constructed.
the building constructed to where it can be added on to?
That I don't,
I'm sure it is. We usually try to build all of our facilities where they can be added on to.
it's a nice rectangle, so.
Okay. I don't really have a problem with this act, because at the time that we had the annex, we did the annex without doing the Bonita office or doing the J clinic or doing the other things that were needed at that time. But also at Redbird, we need a dialysis center down the country. At that time, we had quite a bit going on, and I don't know what the percentages are about who has diabetes and who needs a dialysis. I know that every day someone's telling me that they're going on dialysis. I need an operation. I got to put a tube in my arm so I can go on dialysis. And in the meantime, since that time, I've got diabetes. And I realize that someday I may have to have a dialysis program to go to. But I can't be against this because this is for people. And I just can't be against it. Thank you.
Last question.
Well, David, what if we added the dialysis center in here as an additional building? Hey, it's on the grand plan.
I don't think it'd make any difference, because I think this plan that they're going to come up with, probably have them all there. We've got 6 months, and we're going to go over it before the next 2 months, and I don't think it'll make any difference. You know, I'm for it. Anything's going to help a people. Improve their life and their quality of life.
Well, if you want it in there, I will amend my motion.
I think it's already in the plan. I don't, if they're telling me it's in the plan, it's in the plan. That's what I look at. I'm sorry.
Okay.
Call for the question.
We have a call for question. We also have the second. All those in favor of passing item number 3 as amended, say so by saying aye.
Aye.
Any opposed?
Aye.
Roll call.
Jack Baker,
Yes.
Harley Buzzard,
Yes.
Julia Coates,
No.
Bradley Cobb,
No.
Joe Crittenden,
Yes.
Jody Fishinghawk,
Yes.
Meredith Fraley,
Yes.
Janelle Fulbright,
Yes.
Don Garvin, Chuck Hoskin Jr.,
Yes.
Tina Gloria Jordan,
Yes.
Curtis Snell,
No.
Chris Stokes,
Yes.
David Thornton,
Yes.
Kara Cowan Watt, no. Buell Anglin,
No.
ten yea and 6 nay.
The motion carries. Next on the agenda is announcements. Are there any announcements? I have one. I want to thank everybody. If you'd hold still for a minute, I would appreciate it. I want to thank everybody for their indulgence. When I first got on the council, I come from private practice optometry. I am neck deep in capitalism. And one of my concerns was with politics and government that it didn't go fast enough. And I have found that there are times now that there's a reason for that. I know there are some people on the council and some people that I highly respect that are not on the council that wanted this process regarding Hastings to go faster, and some wanted it to go slower. At the risk of sounding too white, with the exception of possibly one person, and if I'm wrong, I apologize, I'm the only person in this room that has practiced as a doctor in a federal facility. And there have been times when there's been some legal issues, there's been some times when there's been some road issues. That's not my expertise, and quite honestly, I've leaned on some other people. But I do have experience as a doctor in a federal facility. And that being said, I believe we are elected primarily to make law, but we are elected as a voice of the people of the Cherokee Nation. And there were people on this council that had questions, and irregardless of whether some people felt like there was too much time taken, I felt like those people needed those questions answered, and I would do exactly the same thing I did since January. I do the same thing again. So I just wanted to put that forth. When I feel like ample time has been given for everybody to get their questions answered and vote according to how the people that they were elected to represent feel and think, then we'll vote. And hopefully that's what I've done, and I'm a big believer in not cutting discussion off, as most people have kind of found out. So I appreciate your indulgence, and I hope that on the way out you do thank the staff for the last 8 or 9 months, because they have been here late several times. Are there any more announcements? I would entertain a motion to adjourn.
Second.
All those in favor? Aye. Any opposed?